Dear Assembly Member Lucas, my name is Melissa Wilson, and I am a nursing student and resident of Brooklyn, New York. I am writing to raise concern about a pressing health policy issue, inequitable infrastructure investment as a driver of health disparities in historical underserved communities such as those along Pennsylvania Avenue on the tree line. Public infrastructure is not merely a transportational or sanitation issue. It is a public health issue. Neighborhood environment are recognized as key social determinants of health, shaping rates of chronic disease, injuries, mental health stress, and overall well-being. Yet, stark differences in infrastructure conditions between areas such as 86th Street in Manhattan and communities along Pennsylvania Avenue in Brooklyn reflect persistent inequities in investments and maintenance. In higher income neighborhoods, subway station and surrounding streets are clean, well lit, and consistently maintained. Elevators and escalators function reliably, sanitation services are visible, and infrastructure improvements occur proactively. In contrast, communities along Pennsylvania Avenue, home to many working class and African American families, often contend with aging transit infrastructure, inconsistent accessibility features, inadequate lighting, and environmental neglect. From a health policy perspective, these disparities contribute directly to increased risk of falls and injuries due to lighting, poor lighting, and malfunctioning elevators, reduced mobility and transit access for elderly and disabled residents, heightened chronic stress associated with environment neglect, barriers to employment, healthcare access, and economic mobility. Now, as for my proposed policy reform, health equity requires upstream investment in safe, clean, and accessible environments. When infrastructure funding is unevenly distributed, the result is measurable public health inequity. I propose the implementation of a transparent equity audit for MTA and NYC sanitation funding to evaluate how resources are allocated across neighborhoods. We need a strategy that prioritizes need-based investment over return-based investments, ensuring that funding decisions are guided by public health indicators, infrastructure's condition, safety concerns, and community vulnerability rather than property values or economic return. Additional policy mechanisms such as health impact assessments in transit planning, equity weighted capital funding formulas, and public accessible reporting on maintenance allocation would promote accountability and equitable distribution of public resources. Now, some may argue that limited public resources require prioritizing neighborhoods with higher economic activities or transit volume. However, allowing investments to follow property values or patterns of gentrification reinforces existing inequalities for perpetuate preventable health disparities. Long-standing residents should not have to wait for demographic shift to receive basic infrastructure improvements that directly affect safety and well-being. Public health should not depend on zip code, property value, or pace of gentrification. I respectfully urge you to advocate and support legislation that advances equitable infrastructure funding, accountability measures, and a transparent equity audit for MTA and NYC sanitation resources allocation. Communities along Pennsylvania avenues and throughout Brooklyn deserve the same standard of safety, sanitation, accessibility, and modernization afforded to any neighborhood in New York City. Thank you for your leadership and your commitment to the residents of District 60. I appreciate your time and consideration. Sincerely, Melissa Wilson. Thank you.